over. One more chance, 'cause I don't wanna end as the loser. Oh, 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 oh. Oh, 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 oh. Yeah. I must apologize, 'cause I'm so sorry to treat you so cruel. Although I was wrong, team, I was only playing a fool, so please give me a chance so I can make my confession. Although I was wrong, won't you please overrule your objection and give me one chance so that I can make things out with you. Yeah. Oh, 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 oh. Over and over and over. One more chance, 'cause I don't wanna end as a loser. One more chance, so we can talk this thing over. One more chance, 'cause I don't wanna end as a loser. One more chance, over and over and over. See, I was playing a fool. I hope your objection will be approved. One more chance, so we can talk this thing over. One more chance, over and over and over. One more chance, over and over and over. One more chance.
Good evening, and hey, welcome to the Caribbean Voice presentation of the Mind-Body Connection. I must say a happy Monday to each and every one of you locked on to Island Zone Radio. Big up to Mr. I must say DJ Fest is in the house. Hey, the beautiful Varshni, good night to you. Rajiv, how you doing? Harry, George, Nina, Chunilal, Mr. Vishnu, good night to you. The beautiful Geeta Baldeo, Mahendra Baichu, how you doing? Bibi Amina, good evening, good evening. Mr. Dale Moti from the Sunshine State, good evening to you and your beautiful wife, the beautiful Angela Moti. I believe we have to take a look at her performance. And the beautiful Bibi Ahmad, the director of TCV, the Caribbean Voice. Sunil, how you doing? Good evening to you. Ryan Jeffrey, East or West, DJ Fest is the best. Geeta Baldeo, good night to you. And hey, the founder of the Caribbean Voice, Mr. Anand Budram, good night to you, sir. How you doing? And Shanti Chan, not forgetting Ummati Kalicharan, how you doing? And Polly Shamir, good evening to you guys. Happy Monday. And yes, we are all excited. How are you, Ken?
Well, I'm fine. Good evening to you. Good evening to our viewers. Today we're going to be talking about stroke. I want you guys to please share this. It's very important. As you know, a lot of people do suffer from stroke. So how are you doing?
I am fantastic, and I must say, before we continue our program, let's give a special good night to the beautiful Neela Pawaru and the Angels Caribbean Band. I always like to recap on our event that we did. We had a booth at the Angels Caribbean Band event yesterday, bringing awareness to what's going on aside from suicide, and we're trying to promote our candlelight vigil, which is September 10th, and I urge you guys out there. I reached out to a few folks, and I urge them to take a picture, do a candlelight vigil, and send it to us, or hashtag us, the Caribbean Voice. So guys, please do that. September 10th is National Suicide Prevention Day awareness, and hashtag a picture of your group, whatever organization or family group, and send it to us. It's building awareness of what's going on around the world. And when it comes to the candlelight vigil, as you know, we have Ken will be in the studio anchoring down this program, and we would love to take calls from you guys. If you're hosting it, call in, and he'll be feature you on the Caribbean Voice media page, so everyone else around the world could see that you're doing something, making a difference in somebody's life.
Yeah, that's good, and it's a good thing that Neela went yesterday to that show, and she
Neela,
did a fantastic job. It was so organized.
Her kids, and I always say when it comes to family, if you know, her kids were there supporting, and you weren't there, but I believe me, you had your entire household was there. The guys, big up to all of them for doing a fantastic job promoting our T-shirts and all our flyers that we have. People are coming, taking pictures by the booth and saying hi. That to the Caribbean Voice team, Neela and her family, your kids, your family was there. What a team effort it was.
And of course, you were there too.
I was there, and I stepped out, and I came back. Neela said she's leaving, and I said, "Don't worry, I'll mind the booth."
Oh, that's nice. And that's what you call teamwork.
Yes, so we had a fantastic time. Hey, Shanti Chan, good evening to you. Good evening to each and every one of you. If we miss your name, we don't like to miss anybody's name because, you guys look forward. You're sharing. I urge you guys, first of all, to share. Sharing is caring, and it's getting the word out there that you're supporting the Caribbean Voice, a non-for-profit organization that's making a difference and around the world, not just Guyana. Hey, Diana, good night to you. Priya Prasad, the beautiful Priya Prasad,
Yes,
very informative, always joining our conversation, giving our feedback. Annette, good night to you. And our topic tonight is?
It's stroke, but I want to say welcome to all of you who tune in tonight. I see Dear Prasad from here. I'm so glad that she tuned in so that she can hear. I want to say thank you very much for her, that she went to the booth yesterday and made a donation to us. And I'm glad that we have their church, the Trinity Church, here in Queens Village, that's watching our work, and they like what they're seeing. So I hope that we can team up sometime, and they can also join in and do a vigil. I see our good friend of the program, Mr. Arjun Madre. Thank you for tuning in. The Gita Ramprasad, Carol Ann Ramnarayan,
Diana Shivram, and the founder of the No Janjet Group, Mr. Shabir Bash, good night to you. Hey, Tara Thomas, good night to you. And Carol Ann, good night. Gita Ramprasad, Arjuna Madre, I urge you guys to hit share. At least just let it show up on your Facebook page. That's all we're asking. Thank you, Priya. Thank you. Sharing is caring, and it's getting the word out there. It shows that, you mean to make a difference. And the folks that passed by the booth yesterday, they see it's for a really good cause. They see that we need to get suicide, awareness out there and intervention. And they were taking pictures just so they could hashtag it on Facebook and let everyone else who might need it to reach out to us. The Caribbean Voice, 5 minutes of your time could save a life. And speaking of that, Anthony Prasad, Mr. Bollywood, was there supporting the Caribbean Voice. If he's not around when it comes to the concert for Hope, he's always there volunteering his time and his effort. So we did the same thing. One hand can't wash itself.
The other.
Right, washes the other. So we, of course, had his flyer up there. It's September 7th. And we had the Gunga Ghana guy flyer up there also. Supporting Island Zone Radio is Mr. Ryan Jeffrey. That is September 14th. So...
Yes, so we're going to talk about stroke. Do you want to play some music and then we come back to it, or you want us to go straight to...
Well, guys, sharing is caring on us. While we're talking before we get formal, that's what the time we give you guys to hit share and get more of your friends and your family involved. Jamir Mohammed, how you doing? Hey, Kamini, good night to you. And Barbara, how you doing? Mr. John Hassan Khan, good night. And yes, we are full of energy. Ryan Jeffrey said, Mr. Bollywood did a great job on stage. He always give it 100%. Mavis Kasoon, good night to you. Good night to each and every one of you. Happy Monday. And yes, E. Barbero Guzman.
Yes,
That's a Spanish name, I believe.
Yes, and it's so good that we are getting people from I think it was Central America. So it's so nice that we are getting viewers from all different parts of the world. And another thing that we can ask you guys to do, if you are new to this program, just raise your hands and or just type 1 so we can shout you out and give you a special welcome.
That's right. Alex, good night to you. Alex is new. Ganika Singh, good night to the beautiful Ganika Singh. And I believe we have Sarah is pretty new to our program too. Diana Shivram, good night to you. Gita Balde. We know all the regular folks, and we thank you from the bottom of our heart, from Caribbean Voice team, for always being here week after week.
Yes.
And when it comes to Monday, I'm sure your phones start blowing up. Everyone asking you, are you guys ready for Monday program? The excitement. They will reach out. Looking forward that, 8 o'clock we're live.
Yes.
So guys, we thank you on behalf of the Caribbean Voice every Monday, 8 to 10 p.m., the presentation of the mind-body connection. That's right. Ryan Jeffrey is urging you guys to hit share, and more share. And as we get into our topic of stroke, Each year, almost 800,000 people in the United States suffer from stroke.
That's right.
And we need to educate ourselves, and it's never too late to learn about signs and symptoms and how to take care of yourself. As we say every week, your health is your wealth.
That's
and
right.
Anthony showed me a very nice post over the weekend. He said, eat your food, eat your fruits and vegetables so you don't have to eat medicines. Right?
That's right.
It goes
that's
like
right.
that.
That's good. It's excellent advice.
Yes. So we all insist on eating healthy, and to show you guys how you could eat healthy, we implement that on ourselves. So we're eating healthy, we're exercising a little bit more. So whatever we're telling you guys, we're practicing as well. So one day we'll have you guys a live yoga session as we promised, and a dietitian to guide you on how to eat a little bit. But let's continue on stroke and stroke prevention.
That's right. So are we going to get some music now? Yes. Let's go for music, and we come back with stroke, with this serious discussion. As Shanaz said, so many people is affected by stroke, and we want to encourage you guys to do what some of the things that I'll be saying and Shanaz will be saying on the program so that you can live a better life. So let's go for some music.
Queen, good evening to you. Uma, Parma, how are you doing? Kamini, good night. Annette, dear Prasad, good night. Savi, good night, good night.
Much people are dying, committing suicide. Now give your life to God and leave your problems aside. Too much people are dying, committing suicide. Now give your life to God and leave your problems aside. Suicide is not the answer to any problem. Take all your worries to God and He will handle them. Suicide is not the answer to any problem. Take all your worries to God and He will handle them. So live your life with joy and live your life with pride. Now help me sing this song and let us stop suicide. Too much people are dying, committing suicide. Now give your life to God and leave your problems aside. Your mother and your father, they grow you from small. They give you education. Why you want to waste it all? Your mother and your father, they grow you from small. They give you education. Why you want to waste it all? You have friends and family who's always by your side. Now help me sing this song and let us stop suicide. Too much people are dying, committing suicide. Now give your life to God and leave your problems aside. You may feel nobody loves you. Sometimes you feel disgrace. I wish to mend your broken heart and put a smile on your face. You may feel nobody loves you. Sometimes you feel disgrace. I wish to mend your broken heart and put a smile on your face. So put your trust in God and let Him be your guide. Now help me sing this song and let us stop suicide. Too much people are dying, committing suicide. Now give your life to God and leave your problems aside. Too much people are dying, committing suicide. Now give your life to God and leave your problems aside. Give your life to God and leave your problems aside. Now give your life to God and leave your problems aside.
It says, give your life to God and leave things everything else aside. Some folks don't believe in that. So, sometimes meditation helps. Sometimes turning to God or whatever religion you are, a little prayer can be a good distraction. So tonight's topic, we're talking about stroke, and we have Dr. Love is in the building. Good night to each and every one of you, and let's talk a little bit about stroke.
So stroke, someone in the United States has a stroke every 42nd on an average. In 2016, stroke accounted for 1 of every 19 deaths in the United States. On average, in 2016, someone died of stroke every 3 minutes, 42 seconds. When considered separately from other cardiovascular disease, stroke ranked number 5 among all causes of death in the U.S., killing approximately 142,000 people a year. According to data from 2005, stroke was the leading cause of serious long-term disability in the U.S. Approximately 3% of male and 2% of females reported that they were disabled because of stroke. So, Shanaz, when you get stroke,
and
or when you
various
suffer from
type of stroke we'll
yes,
get into.
we'll get into that. It causes a lot of problem. You lose your job, you can't function, you can't go anywhere. So that's why they're saying it's causing so many problems. And then we also know that males get more stroke than females.
And signs as well.
Exactly.
Females
So
don't have as much as signs and symptoms like a male would encounter.
right. In 2016, there were 5.5 million deaths contributed to cerebrovascular disease worldwide, 2.7 million deaths from ischemic stroke, and 2.8 million deaths from hemorrhage stroke. Sudden cardiac disease in 2016, any mentioned sudden cardiac arrest mortality in the U.S. was 366,494. What was also found is that a lot of people had experienced cardiac arrest at home. And so, another good thing that we like for people to do and to learn, and we can always encourage people, no matter who it is, no matter how layman you are, to learn CPR. That if someone, since this study found that most people get cardiac arrest at home, we want to encourage your family member to learn to do CPR. And probably sometime down the road, we can come up with something where we can show you how to do it, even if you don't know how to do it.
Field. You don't have to be in the medical
Right.
field to learn CPR, because you could save someone's life on the subway, in a grocery store, and knowing that you help someone feels very good. On my flight back, someone was having a problem, and thank God we had a doctor on board. They came, and you never know where you're encountering difficulties. Well, getting back to stroke now, there's maybe 2 kinds of stroke.
Right, we'll get to that in just a minute. So yes, and the other thing is that I want to encourage people to, even if you don't know how to do it, if long time back in Guyana, from what I know, you hear somebody die, so what do? You run and you stand up and watch. Things are changing now. We want to educate our viewers that what happened if you see somebody's dying, they're dying, they're dead. You can always, even if you don't know how to do CPR, you fold your fist up and you press on their chest and go as long as you can. But make sure while you're doing that, you call 911 and you give EMS employees, the workers, a chance, give your family a great chance to survive this heart attack that you're having. So it's always a good thing, Shanaz. I have to teach my boys
and it says
to do
4
these things.
facts on how to prevent yourself. So let's talk about stroke. We'll get into the basic. What is stroke? And stroke is basically a blood clot in part of your brain, or a lack of oxygen towards your brain.
That's right.
And time matters when it comes to stroke and stroke victims. So time depends on as soon as you could get it. And a lot of doctors, all the doctors, and it's so healthy to keep baby aspirin, 81 milligram, because of this situation. You put it under your tongue, let it dissolve, and it will help, and it will make a difference. Time matters when you're having or encountering some symptoms of a stroke.
Yes, and the overview of stroke. A stroke occurs when the blood supply to parts of the brain is interrupted or reduced, depriving the brain of oxygen and nutrients. Within minutes, brain cells begin to die. And as you said, that is one of the reasons why it's so important that you get help. When you notice someone is having a stroke, you try to call 911 as soon as possible. It is considered a medical emergency, and prompt treatment is crucial. early action can minimize stroke damage and potential complications. You know, the good news is that stroke can be treated and prevented, and few Americans die of stroke now than in the past. And why so? Because people are being educated, like how we are doing now. We are teaching people things that they can do to prevent this. And we will talk about diet. We will talk about exercise later on. We can talk about symptoms. You watch for the signs and symptoms. If you think that you or someone else may be having a stroke, pay attention to when the signs and symptoms begin. The length of time they may be present can affect your treatment option. And that's why we're saying, as soon as you notice someone is having a stroke, you get help. And I'm going to continue saying this because it is so important that you get help as soon as possible. You want to know that the person you will see will have trouble speaking and understanding. You may experience confusion. You may slur with your words or have difficulty understanding speech. Paralysis or numbness of the face, arm, and legs. You may develop sudden numbness, weakness. Then this often happens just on probably one side of your body. Most of the time, like one side of your body, you will notice all of these signs happening, the sudden weakness, and it's all sudden, right? Trouble seeing in one or both eyes. You may suddenly have blur or black vision in one or both eyes. You may even have double vision. Another thing that's important, you may have like serious headache, a sudden serious headache which may be accompanied by vomiting, dizziness, and altered confusion. They may have trouble with walking, or they may stumble and experience sudden dizziness, loss of balance, loss of coordination. I tell you that you and I know recently we did have this kind of experience where we experienced that someone was having a stroke. Luckily that the treatment, the person went to the hospital just in time, where and I tell you, we see this, that, and you witness it too for yourself.
Experience. I encountered this last week too with a family member, and you know, a lot of time they said weight has something to do with it, but these are both members that I've encountered was skinny personnel. So another sign, symptoms, smile. If you could see one face drooping, then you know there's a sign of that. Raise both arms and drop it down. Say a short phrase so you know your speech is not slurring. So these are signs and symptoms you can look forward to. And if you are impaired, then you have to call 911. Always have someone to call 911.
That's right. If you notice any one of these things going on, you make sure you call 911. The longer a stroke goes untreated, the greater the potential for brain damage and disability. So we can go for a song now, and when we come back, we will talk what really causes a stroke. Okay?
That's right. Let's go.
Thinking suicide.
This is Satish Udairam, and I say suicide is not the answer. There is always a helping hand for a brighter tomorrow.
Why? Tell me why? Why we thinking suicide? Why? Tell me why? Why we thinking suicide? Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we cuss and fight. Tell me why we drink and drive.
Maureen Ramchran, good evening to you. Good evening to the beautiful Delari Sigoben, Gita Baldeo. Good evening to each and every one of you. Sheila Mangar, how you doing? Deepa Dasrad, good evening. Good evening to each and every one of you on Island Zone Radio. How you guys are doing today? The beautiful Renetta Jeffrey is here. And hey, DJ Fest just left the studio. Big up to DJ Fest. Rocky, how you're doing? Hey, Mr. Vinod Harry, how you're doing? Thank you guys for tuning into, hey, the Mind Body Connection by the Caribbean Voice.
Tell me why we thinking suicide. Tell me why we thinking suicide.
You, and you, be that change. Take a stand. Suicide is not the answer. Satish Udairam say, faith, hope, and love.
If you feel like giving up, today is not the day. Give love a chance, you will shine another day. If you feel like giving up, today is not the day. Give love a chance, you will shine another day. Give thanks and praise to the ones who love you, and the ones who hurt you, let them go them way. Why? tell me why we thinking suicide? Why, tell me why we thinking suicide? Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we thinking suicide.
Suicide is everyone's business. Life is too precious. Why suicide and not love?
Love should be the answer to all we problems. Love is the thing that live under we skin. Love should be the answer to all we problems. Love is the thing that live under we skin. Flow through we brains and into we veins. Love should be the answer to all we problems. Why? Tell me why? Why we thinking suicide? Why? Tell me why? Why we thinking suicide? Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we thinking suicide.
Thinking suicide. Sometimes it's very hard to answer that question when you were not in that person's shoes, right?
That's right.
Well, that is Satish Odairam, a spokesperson from the Caribbean Voice, sending out a good message. And we have a lot of singers representing the Caribbean Voice, putting out beautiful song, beautiful music out there that's making a difference. We also have someone from Jamaica joining our cast, Mr. G Mac.
That's right. That's right. And you know what I like about the message? He also said, don't drink and drive because you can cause so many problems.
And in Guyana, there's so many accidents we've seen happening recently, major accident, not just a fender bender, where lives are lost. So guys, don't drink and drive. Stay alive, arrive alive. If you have loved ones who care for you, it doesn't worth. It's not worth to drink and drive. Omati, good evening to you. Juanita Khan, how you're doing? Good, Gita, thank you very much. Savi said depression and anxiety causes suicide. That's right. Also health, mental health is very important. You have to talk to somebody. And chronic illness on like stroke. Someone don't know how to deal with those situations. So we're empowering you guys. We're telling you, take your health seriously. Your health is your wealth.
Absolutely. And also don't forget, Shanaz, we have, suicide. It's coming up on the 10th, right? We have our vigil. So we encourage you guys to continue on the September the 10th. Gather up your cousins, your family, some of your friends. If you're from church, you can get your congregation, join our team, the Caribbean Voice, and we'll light some candles, even to the corner of your house somewhere. But as we say that you should be do it safely. You know what I mean?
That's right.
And we will do a live on this.
You guys should feel free to call in on the Caribbean Voice media page, and Mr. We have our co-host here who will be here anchoring that program. And the excitement is seeing what's happening around the world. I know we'll start at 7 o'clock, but we'll go until 10 just to get most of the videos in. Hey, good night to the beautiful Lina Iraqi, the beautiful Neela Pawaru. Good night, you. And good job yesterday. I must say it's teamwork. And we want to see everyone around the world. So if you have family and friends in Florida, wherever they are, encourage them to organize a candlelight vigil and call into the Caribbean Voice. The call wouldn't be long, maybe a minute long, to see what's going on and to bring awareness that, last year we did almost, remember the number we did last year in Candlelight Vigil?
I'm not too sure.
It's over 200, but this year we're looking to get bigger and more people involved with what we're doing. The Caribbean Voice is a non-for-profit organization. We believe 5 minutes of your time could save a life. And suicide prevention is everybody's business. And on this note, I want Ken to give a special shout out to the beautiful
Fiona Singh.
That's right.
Yes,
Our
yes,
own chutney queen of Guyana. Good evening to you, Fiona. How you're doing? Navin, good evening to you. Lorraine, how you doing? Roxanne Walker, thank you guys very much. Sharing is caring.
I also want to shout out Lorraine Ramsunder. She's my batchmate in nursing. We started nursing back in 1985, and she went on to be a medics in Guyana. Her son is also a doctor at the West Damar Regional Hospital. So my batchmate, I'm so glad that you tune in. Please share the word, share it to our other batchmates, and please continue the good work that you are doing too in making a difference. I see Navin tune into.
We'll read Vinod Hari's comment because everyone loved the song done by Mr. Satish Udairam, a spokesperson for the Caribbean Voice. And Vinod wrote, here's an idea to curb suicide. Parents, particularly Guyanese parents, should give their children the talk on reality and sex education. And I believe, especially over here, they do have the class in school.
Yes, they do.
10th, 8th grade, I believe they start doing sex education. So, yeah, in Guyana, it's still very old-fashioned. They still need to get, out of the
realm of things, the old-fashioned way, as you were saying. And as parents, it is good. You know what I always think, Shanaz? It's best we teach our children what's right than we let people teach them outside what is wrong and to lead them to the wrong things. So as parents, we should empower ourselves, learn as much as we can, and share it with our children. We don't have to be friends with our children, but as parents and children, we can share some things, our life experience with our children, and that's going to move
That's right. It
far
shouldn't
way.
be a taboo topic anymore to talk about. And you're so right, Mr. Vinod. Thank you very much. The beautiful Fiona Singh joining our Caribbean Voice. Mr. Says Narayan Ramdat, how you're doing? Good night to the beautiful Auntie Nalini and Uncle Michael Naidu. Good night to each and every one of you. Share the link, guys. We're trying to get everyone on awareness when it comes to health. And tonight we're talking about stroke and what could cause stroke.
So there are two types of stroke. You have the one that's hemorrhagic and ischemic. Hemorrhagic stroke occurs when the brain artery rupture, and like I was telling you earlier today, that we know someone who just had a rupture in the brain. We were lucky that he got help, and he's doing fine. An ischemic stroke occurs when the blood supply to the brain of the brain is cut off, and guess what? That could cause by clot or plaque. So an ischemic stroke occurs when the blood supply is cut off from parts of the brain, often related to a blood clot or a plaque. When this happens, the blood that's going to the brain, it's lost the oxygen, and it cannot carry the nutrients and the oxygen to the brain, and causing problem. That's why we say that every minute's count. When the brain tissue is deprived of blood for more than a few minutes, the brain tissue begins to die. Brief losses of neurological functions often occur before a full-blown stroke and are called TIA, as you probably heard.
That's a mini stroke.
That's like a mini stroke, yes. A TIA occurs when the blood flow to a certain part of the brain is cut off for a short period of time, usually 15 minutes or less. Although TIA is a painless episode, it is important, and it's an important sign. TIA warning signs are similar to that of a stroke, even though TIA do not
an actual
last.
Stroke. It lasts for a few minutes, and then it gets back to normal, where the blood flow continue and your symptoms will also disappear.
Yes, but the important thing to do in that case is that you need to go to the doctor and try to get some help. That's the best thing to do. The symptoms, some of the symptoms is like loss of speech, vision problem, weakness of muscle, and as I said, severe headache. Ischemic stroke tend to result from either a clotting, that already narrowing vessel, much like a typical heart attack, or from a clot that forms some part else of the body. And what I want to say, I remember one of my uncle who died many years ago. He had a carpal tunnel surgery, and the next day, I don't know how he developed a stroke. A clot, and he died the next day. He didn't even have a second chance to live. So it is very important to take these things seriously
Well, a hemorrhagic stroke is very serious. It's less common, but it's far more dangerous than a regular stroke. It occurs when the blood vessel in the brain is burst, and that's you can't control the bleeding sometimes. So that is far dangerous than a ischemic stroke or a TIA mini stroke.
Right,
but the
right.
symptoms are all the same. So guys, your health is your wealth, and you have questions, put in our chat box and we'll be happy to read it to you. Ryan Ken, thank you for joining us. Maurice Gomez, good night to you. Rahamat, how you doing?
And so I want to tell them that, some of the signs that they should be looking for, like I said earlier, a sudden loss of speech, slur vision, sudden loss of vision, blur or double vision, sudden paralysis, sudden weakness, sudden dizziness, sudden severe headache, often with neck stiffness and vomiting. Remember, I said before, the time is brain. The longer that the brain cell go without fresh blood or oxygen makes the damage more likely to be permanent. The chance for survival and recovery improve when treatment begins within the first hour after a stroke has occurred. And one thing I know, that if you get a stroke and you go to the hospital, the
First thing they will do is administer
the aspirin.
an aspirin because they are blood bursting drug. It's a blood bursting drug.
It's a blood thinner.
Aspirin. They have a lot of forms of blood thinner.
So and we will talk about some of that later. So what happens when you call 911 and you go to the hospital? Remember, when EMS comes, your treatment starts right there. And as soon as you enter the emergency room, your treatment, they are very aggressive with the treatment for stroke. Because guess what? Like I said earlier,
every second
as that clock is ticking, your life is ticking too. So you want to make sure you get there as soon as possible. And it's important, like sometimes, like I said, and I see that on an everyday basis, you have elderly people, don't let them stay in the bed. Don't let them sit in the bed all day, because guess what? You might go upstairs and find someone is dead. So you always have them sit somewhere that you can really keep an eye on them, because you know what, you are the best advocate for your family.
That's right. And at the emergency room, the first thing they will do to check for the type of stroke and the blocked vessels and bleeding vessel, they will do it by a CAT scan.
CAT scan, right? They do a CAT scan and they will tell,
And which is worse, they all do, it's two types, either be a blocked vessel or a bleeding vessel.
Right. And sometimes when there is a lot of damage in the brain, they can go in there surgically and try to suture things up and do what they got to do,
As a CAT scan will be done to determine what type of stroke it is and where it is, because they could be treated differently. They have to treat it differently.
That's right. So we can give some shout out on, then we come for some music. In the meantime, I see Paulo Nito. He is all the way from Portugal. Well, thank you very much for tuning in.
Nadira Prasad, good evening. To you, Gita Balde, Juanita Khan, good evening. And Auntie Lady, thank you for supporting the Caribbean Voice yesterday at Smoky Oval Park. Thank you guys for tuning in to Island Zone Radio, the Mind-Body Connection, every Monday, 8 to 10 p.m. on Island Zone Radio. Let's go.
Tick, 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 tock. Hopefully set your feet, now you got the club locked. No matter what they say, baby girl, do right.
Good evening to you. Priya Prasad, thank you very much. We'll read that comment when we return.
कुड़ियों का नशा प्यारे नशा सबसे नशीला है जिसे देखो यहाँ वो की बारिश में गीला है इश्क के नाम पे करते सभी अब रास लीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है
लड़कों का नशा प्यारे नशा सबसे नशीला है जिसे देखो यहाँ वो हुस्न की बारिश में गीला है इश्क के नाम पे करते सभी अब रास लीला है
मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है
सिंपल सा ये फॉर्मूला है लव का फंडा खोखला मुझे बस प्यास तो ये दिल कूल 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 रहता है
किसी का हाथ थाम के रहते क्यों बात नाम के हलवे यू फॉरएवर कोई फूल 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 कहता है इसे पीने से है मतलब जो यौवन संतरीला है फर्क पड़ता है क्या बाहों में मुन्नी है या ये शीला है इश्क के नाम पे करते सभी अब रास लीला है
Voices Against Violence Candlelight Vigil is World Suicide Prevention Day, September 10, 6 p.m. Organize a candlelight vigil today. Together we're working to prevent suicide.
Tick, tick, tock. Oh, please set your feet, now you got the club locked. No matter what they say, baby girl, you rock. Wind that thing out, shake that thing out. Back and forth, me love the way you swing it. Art and soul, y'all, you was feeling. Do it to me right, we can do it all like that.
ये चर्चा फेसबुक पे है मजा बस एक लुक में है हंसी चेहरे का कौन दीदार बार 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 करता है
जो दिल का फोटो फ्रेम हो वहाँ फोटो के सेम हो कैलेंडर की तरह उसे रोज 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 चेंज करता है
कमर पतली हो जितनी भी मजा उतना नशीला है चलेगा जो भी है आंखों का रंग काला या नीला है इश्क के नाम पे करते सभी अब रास लीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है कुड़ियों का नशा प्यारे नशा सबसे नशीला है जिसे देखो यहाँ वो हुस्न की बारिश में गीला है
इश्क के नाम पे करते सभी अब रास लीला है
मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है मैं करूँ तो साला कैरेक्टर ढीला है
Manifest the world and DCF is a non-profit organization together with Elite Sounds present the biggest chutney event to hit New York City for 2019, the second annual Caribbean Fest 2019 on Saturday, September 14th at the Amasura Concert Hall, 91 to 12 144 Place, Jamaica, New York, featuring with his first performance in New York City, Kubraj Prasad. Also pairing with his first performance in New York after 10 years, David Angatu. The Raja Rakesh Yankaran. The Hurricane Himlata Tindial. International dancer Dheeraj Gayaram. The Chutney Queen Fiona Singh. Rishi Gayadeen, Thomas Singh, and the Wave Band with their first performance in New York City. Your DJs, Elite Sound, DJ Fast, and DJ Andy. Doors open at 7 p.m., showtime 8 p.m. Tickets in July, $25. In August, $30. And in September, $35. More at the door. Get your ticket at Star Wireless, Sing's Roti Shop, Roti Paradise, World of Spice, and Bunny's Roti Shop. For info and VIP tables, please call 862-686-4825 or 347-570-1638.
Welcome back to the Caribbean Voice presentation of the Mind-Body Connection. We are looking for the beautiful Priya Prasad's comment as we look forward and reading your comments and all your feedback. Mr. Shabir Baksh, good night to you. How you doing? Good evening to Linai, Auntie Nalini, Marilyn Jaikaran. How you doing? Renita Khan, Mr. John Nimat, and so many wonderful folks joining us. The beautiful Liz Paduman, Danny, how you're doing? Good night to each and every one of you. If we missed your names, which we don't like to miss your names because you're giving us your time, and we love to acknowledge each and every one of you, especially for those of you who are sharing. Savitri, good evening to you. Arlene William, how you're doing? Sharing is caring and is getting the word out there. We're looking for the beautiful Priya Prasad comment, but we'll read it.
Yes, and I see Annette the Prasad is on again too. My cousin Agnes Ramphal, thank you very much, my dear, for tuning in. Sandra Kandai, thank you for tuning in to the Mind-Body Connection, which is brought to you by the kind compliments of the Caribbean Voice. As you know, the Caribbean Voice is a non-profit organization that deals with suicide prevention and domestic violence prevention. So as you guys know, we will be having a vigil, and we encourage you to have a vigil on September the 7th around the world. You don't have to be a lot of you. 3-4 of you could sit down and gather together, especially if you lost someone, that you can sit down and reminisce and see what you could have done different and see how you can help someone else with suicide. And what I was saying too, and we say that you don't have to lose someone to join in this vigil.
Or bring awareness for it.
Absolutely.
Right. So let's read Omti Kalicharan's comment. This is more dangerous when you have a headache. My sister died because the blood vessel ruptured and bleeding was too much. Destroyed the brain. She was brain dead at 1 month before
her heart gives up. She was just 42 years old. Well, we are sorry to hear this happen to you. And thank you very much for sharing. I see Mavis Kisoon tune in. Thank you, guys. I see John from Queens already. He's on too. Watson, Kamachi Watson, thank you for tuning in. Your girl Varshini is on too.
Good evening to beautiful Varshini, Nadira, Roshan. How you doing? And let's say the Caribbean Voice join together with each and every one of you. You should join together with us and organize a candlelight vigil September 10th. That's right, candlelight vigil September 10th. Whether you're in your block,
the evening,
area, if you, as you said earlier, when you're riding around, the guys could ride around with a candle or an alert, a sign.
Sign on the back, pin on the bike or on the shirt, and like we said before, it doesn't have to lose someone to suicide to support this cause.
That's right. Light a candle by the window or a deer, something to bring awareness that you know what's happening around the world, and you would like to put a stop to it. We, the Caribbean Voice, can save a life. We reach out to so many folks. Over 400 lives have been saved by counseling, and now this is time you have to put into talking to individuals, right? So you make the time and call us, whether you know someone is struggling with something. We will take the next step and setting up that meeting and initiating that. Make sure that everything runs smoothly.
Yes, and also while we're talking, I know, Shanaz, you can continue, but, we are collecting donations for children who are less fortunate in Guyana, who doesn't have a parent or who can afford, if you want to donate anything like pencil, ruler, books and so on, backpacks, please don't hesitate to contact the Caribbean Voice, Shanaz, myself, or Anand Budram. And if you're in Guyana, you can always contact Bibi Ahmad. Also, if you have wheelchair, diapers, whatever that people can use, don't hesitate. Give us a call. Rather than you see it in the garbage, throw it in the garbage, we will make good use of it. I know Shanaz sent 2 crates to Guyana, and she is packing more stuff.
We're urging you guys to call us for those computers, slightly used computers. Don't give up on them. Get it fixed and donate it to the Caribbean Voice. We're helping 2 schools in Guyana, and it feels good to know that the kids have access to computer. They could do their research, they could do their homework, and you're empowering and enlightening someone at the same time of technology. RW Home Improvement, good evening to you, and you'd like to be a sponsor on this program, do reach out to us. Maria Harris, good evening to you. Priya Prasad, good evening. And that's right, Caribbean Voice Media, Nadira Roshan, good evening to you. Thank you very much. Sharing is caring. We urge you guys to share.
And I see Priya wrote earlier, I saw her comment, but I just read it briefly, where she said her grandmother had a stroke and she recovered, and then she had a second stroke and which she died. She didn't make it. And this is one of the things, I'm always advocating for, is that if someone has stroke, they don't have to be in bed all the time. It doesn't work this
Therapy.
way.
You need to get out. You need physical therapy because that's what's building back. It's learning how to walk again and moving your hands and speech impairment. So you need physical therapy. And in Guyana, I speak of Guyana because that's what I noticed it happened.
Right.
In Guyana, some folks, elderly folks will be in a hammock rocking all day, and their side might be paralyzed. But you never thought, this person should be moving around, doing things. You just put them in the hammock all day and forget about them because they're sick. They're disabled. You consider them disabled. They actually need physical therapy because you could build back those muscles.
Yes, and I had the discussion with Geeta last night. We were saying that, back in Guyana, when you're sick or your foot, you got a fracture or you get stroke, people think what you have to do is cover up and lie in the bed. It doesn't work that way. You do not get well by doing that. What you have to do is get up and move it. Exercise, walk,
That's right.
Do things to help yourself. So let's talk a little bit about, I'm glad Mr. The guy who does all the work actually around here in Queens, and I can hope that, yes, he can be a sponsor for this show.
RW Home Improvement.
Yes,
that's
he does a lot of work around Queens area
Maria
here.
Harris, good night to you. Lena, good night to you. And the beautiful Dolores Sigubin said, my sister died with the blood vessel rupture. She was only 53 years old.
And that's my mother who died. She's referring to my mother. Her blood pressure was up. I was in the States. I didn't know what was going on really there. And so she died at age 53 with a ruptured brain. She lived about 5 to 6 days, and after that she died. What an unfortunate thing. And it was sad for me because, here it is, I'm a nurse here taking care of other people, and my own mom died in Ghana.
So she died from hemorrhagic stroke.
Yes, absolutely,
Okay.
So,
and that is more fatal. That's one of the dangerous stroke there is. It occurs when a blood vessel bursts in the brain, and stopping the bleeding could be difficult, and you lose all senses.
And if you're in the United States, you have a better chance, I believe, in recovering from these kind of things.
That's right.
Because over here you have time, as we said, is essence when you have a stroke. Over here you have all these ambulance services. You call 911 within 5 minutes they're here, but in Guyana you doesn't have all these services. I see Dia Roy join our conversation. Naresh Jaggernaut, thank you very much.
That's right, John Nimmet. He wants us to say he's late again. So you're late again, Mr. John Nimmet. So you're urged to share 5 times. Renita Jeffrey, good night to you. Gita, good night to you. Good night to each and every one of you locked onto Island Zone Radio. The guy we said is coming September 14th is a Gunga Ghana guy. Get your tickets today, and I have all the VIP tickets. If you want to have a table and you just want to come out and see Mr. Dubraj Prasad, the date is September 14th, Amazura Concert Hall, as we support Island Zone Radio and manifesting miracles around the world.
Second, okay?
Wahida Ali, good night to you. Maria Harris, Gita Baldeo, thank you. And we have a caller, and the caller is calling us from
the beautiful island of Trinidad. Zarina, she's going to tell us a lot of things, what she is doing in Trinidad for the Caribbean Voice. So, my dear Zarina, a very good evening to you, and welcome to this program, The Mind-Body Connection.
Good evening to you too, Kenneth, and good evening, Shanaz. Thank you.
You're welcome. So, tell us what's some of your plans for Trinidad.
Okay, basically right now we are in the middle of working on our backpack project so that we can help those who are not so fortunate and having a little difficult time getting things together for school. That will finish on Thursday, and right after I jump into putting together some work so that we can have a vigil, so that people can remember that. Suicide is very prevalent in this society. I'm hoping that I can engage other NGOs and organizations, both faith-based and civil, so that they can do something that would sensitize the communities about suicide. I'm presently working on some of the areas in which we can highlight the issue, but I have not yet reached out to the organizations as yet because I was busy with the backpack project. So as soon as I give off my last bag, I'm on with the project. Hopefully too, I would also like to engage other NGOs so that they can work with the Caribbean Voice in educating and sensitizing communities about domestic violence and how we can mitigate or prevent such instances from happening, because it's very prevalent in our society.
That's right. The Caribbean Voice is extending, we're growing, and we're hoping that you guys could join us to become a spokesperson for the Caribbean Voice, spreading a positive message. We have one of our members in Trinidad.
That's right.
And she is doing a fantastic job bringing an outreach and organizing a candlelight vigil for the Caribbean Voice as we build and bring awareness of what's happening, not just in Guyana, but around the world. And we need to make it known that suicide is not the answer.
And it's everybody's business.
Yes, it is everybody's business.
So I hope that you can get some people to help you guys there too,
Yeah, I'm sure that there are other organizations who will be working on towards sensitizing and bringing out a positive message and trying to educate the public on September 10th. It's just for me to liaise with them and get them to share with us whatever it is that they're doing and see how I can collaborate.
Well, thank you for reaching out to us and doing your part. We look forward in getting a lot of youth involved because, you know, the youth message goes a far way as we have a youth group in New York City and an elderly group. We hope that you're doing the same in Trinidad. Thank you for all your dedication towards making a difference.
Yes, guys, and this is Serena. She is based in Trinidad and Tobago, and she's working alongside with us here, the Caribbean Voice. So thank you for tuning into the Mind Body Connection. Is there anything else you want to say, Zarina?
At this point, no. I'm just grateful to be a part of the Caribbean Voice and to be sharing with such awesome people and learning a whole lot from you guys. Thank you.
Well, you're most welcome, and that's the plan, you know what I'm saying? And please continue to do the fine and wonderful job that you are doing in Trinidad and Tobago. Thank you very much, Serena. And have
Thank you, Kenneth.
a good night.
Good night. Thank you.
Good night.
You too.
All
Bye.
right, bye-bye.
Spokesperson representing the Caribbean Voice from Trinidad and Tobago. Her name is beautiful Zarina. And yes, we have so many members happily and eagerly to join our organization, the Caribbean Voice. And when we say our organization, we speak because we treat it as our own organization, the things that we would do and wouldn't do for, let's say, a particular organization. Everyone feel like they belong to the Caribbean Voice. That's right. And I'm so glad we're getting a lot of new members to join the Caribbean Voice in fighting domestic violence and suicide prevention in the world, especially in our beloved Guyana and Trinidad and Tobago and other like St. Vincent and so on, you know? That's right. Maureen Ramcharan. Hey, welcome, Mr. B. Ram Jairam. How are you doing this evening? Lynite, thank you very much. Mr. John Namat Wanita Khan. And for all of you folks who are commenting, we're hoping that we can check back on the Facebook and see it's, you know, the share is on your Facebook wall, especially Mr. John Namat, who's keeping our chat so busy. A candlelight vigil to show support for suicide prevention to raise awareness. John, I'm hoping that you will organize one in Suriname for us. So for Waka Suriname, Arjuna Madre, good night to you. And that was our caller from Trinidad and Tobago. Debbie Roberts, how you doing? That's right, and she is the Trinidad and Tobago coordinator for the Caribbean Voice. So if you're living in Trinidad and Tobago and you need any assistance, you can always reach out to her. And her name will be in the chat box, so you guys can reach out to her and, you know, organize something together. Big up to Trinidad and Tobago. Big up to all the artists we have in Trinidad, Mr. Hunter, and not forgetting Nati Ramatar, a spokesperson for the Caribbean Voice. And soon to be, we'll be launching Concert for Hope in Trinidad because we also need to build that awareness of what's going on and what, you know, who TCV is. And they know we're going to be making a difference. So big up to Trinidad and Tobago. Yes, Debbie Roberts, good evening to you. Arjuna Madre, Maria Harris, Naresh Jagannath, what you doing? Good evening to you guys. And we'll continue with urging you guys. September 10th is our candlelight vigil. Call in on a video chat with the Caribbean Voice media page. That is a Caribbean Voice media page. I want you guys to share it, the Caribbean Voice media page, and you could go live on September 10th with your anchor, who will be in studio, Mr. Kenneth. So with all that talk, we believe... That's right, and we're going to go to some music. But before we do that, let me give you, we have a special phone number for, if you want to call us in studio or call me in studio on September the 10th, you can call 917-767-2248. Again, 917-767-2248. If you plan to have a vigil, just contact us, okay? And for that night, that's a special number that you can call in. Let's go for some music. It's all about one love.
One love, one heart. Let's get together and feel alright. Hear the children crying. One love. Hear the children crying. One heart. Saying, give thanks and praise to the Lord, and I will feel alright. Saying,
fight is holy and a Gideon. One love. So when the man comes, there will be no doom. One song. Have pity on those whose chances grow thin. There ain't no hiding place from the Father of creation. Yeah, yeah. One love. What about the one? One love. What about the let's get together and feel alright? I'm pleading to mankind. One love. One heart. Give thanks and praise to the Lord, and I will feel alright. Let's get together and feel alright. Give thanks and praise to the Lord, and I will feel alright.
Let's get together and we'll feel all right. Remember, we are here for your support. The Caribbean Voice, we are a non-for-profit organization making a difference around the world. We have on the phone line tonight the founder of the Caribbean Voice, Mr. Anand Budram. Good night to you, sir.
Good night, Shanaz. Good night, here, Kenneth.
Good night, Anand. So,
am I on?
yes, you are on.
Okay, I just wanted to make this point since Zarina had come on. As you mentioned, Zarina is our coordinator in Trinidad and Tobago. And a couple of weeks ago, you had Cassandra Fox, who is our coordinator in Barbados. And we also are working in Jamaica. We have Dr. Lauren Barnaby, who is a member of our board of directors, and we have GMAC, who is one of our spokespersons. And I'm mentioning this because two things. One, we need to expand our membership here in North America to include Jamaican Americans, Trini Americans, and Bajan Americans. So that's one appeal I want to put out, that whether you're from Jamaica, Trinidad, Barbados, but you're living here, please reach out to us so you can become part of the Caribbean Voice, since we're operating in those nations. And two, if we have people living in those places but listening to this program, or you have friends who reside in those places, we need to build a group there also. So in Trinidad, you can reach out to Zarina, and we're going to post the information. In Barbados, you can reach out to Cassandra. She's on Facebook. And in Jamaica, we don't have a contact there right now, but we've got Melanie Hall, who's a member of our group here. She's Jamaican, and she's our liaison with the Jamaican community. So you can reach out to her. All of that information we're going to post in the chat that is flowing along. So yes, Caribbean Voice is expanding, and we need to expand our membership to include all those countries in which we're operating, both outside and inside of the countries.
Okay,
guys. That's all I wanted to say.
Okay, thank you very much, Anand.
Mr. Anand Budram is the founder of the Caribbean Voice, making a day-to-day difference when it comes to our life as well. He's always in the loop, and it's a group chat where someone might say, how do you guys know what's happening? Because we keep each other informed. If I know of something, we inform each other in the group, and if Kenneth knows of something, he'll inform us, and he'll also reach out to others in need.
That's right, that's right. So let's talk about some of the complications that happen if you have stroke. A stroke can sometimes cause temporary or permanent disabilities, depending on how long the brain lacks blood flow and which part of the brain is affected or was affected. Okay, so as we said again, I'm going to tell you this again, repeat this again over and over. You know what? The quicker you get treatment for someone who's experiencing a stroke, is the better for them. They'll recoup faster. One is paralysis or loss of muscle movement. You may become paralyzed or on one side of your body, the loss of control of certain muscles, such as those on one side of your face or your arm. Physical therapy may help you return to activities affected by paralysis, such as walking, eating, and dressing. So, it's always important, Shanaz, that when you get a stroke, don't lie up in bed. It's not a good move. When the doctor gives you permission to do some activities, make sure you get up and walk. And you don't have to walk a mile. Get up, make a couple steps today. Make 10 today. Tomorrow, make 15. The next day, go start slowly.
Slowly
go.
Push yourself one step at a time. and you'll see improvement.
Another thing is that when you had a stroke, your muscles on your throat area, it becomes weak. So you are prone to become aspirated. When I say aspirated, your food can enter the lungs. So you don't want to do that. You want someone to sit up upright, straight, and so they could sit down properly and eat their food. And like I always say, with my experience, have someone sitting right next to that person while they're eating. So if by chance the food they aspirate, someone could start hit them on the back and pelt that food out, knock that food out that's blocking the airway. And it's an important thing to do. And I'm saying this so that people can learn and know what to do. Difficulty talking or swallowing. A stroke might affect, as I said, control of the muscle in your throat and your mouth, making it difficulty to talk clearly, swallow, or eat. You also may have difficulty with talking with your language, including speaking or understanding speech, reading, or writing. Therapy, a speech therapy or pathologist would do very well with that, and that's why it's important. You know what? As soon as you get a stroke and you go to the hospital, guess what? They start action on you saying
time
as soon
matters.
as possible.
Time matters. Every second counts.
Right. There will be some memory loss or thinking difficulty. Many people who have had a stroke experience some memory loss. With this individual, I see there is no memory loss whatsoever. He knows what happened 60 years ago. Others may have difficulty thinking, making judgment, reasoning, and understanding the concept. And another thing, Shanaz, if someone is having problem talking, don't forget you can always utilize
sign
a pencil
language.
And
sign language
and
cards,
give them something to write.
Because someone asked me, Shanaz, why did you go so often to Canada? Because my aunt suffered from a stroke. So I was at her bedside feeding her, making sure she's eating right, and to communicate with her, we used those sign cards because her esophagus was, short. She was short of breath and her was blockage, and all the signs and symptoms was there. So guys, take care of your loved ones. Spend a minute to make sure they're okay and they're eating well, sleeping well. If you need someone to talk to, reach out to us, the Caribbean Voice. We're here to help. Your mind and your body is very important. Pay attention to it and join us every Monday, 8 to 10 p.m. for the Caribbean Voice presentation of the Mind-Body Connection. Also, when you have a stroke, you know what, it can be very difficult. People who have had a stroke may have more difficult made difficulty controlling their emotions, and they may develop even depression. So that's why when someone can you imagine though, Shanaz, that you have a stroke, you were doing so many things, you were driving, you were doing so many things. Emotionally, physically,
and then you can't do these things no more. It have to be very difficult. So that's why we're saying that you have to have a little patience with them. Also, we have pain, numbness, or other strange sensation may occur in different parts of the body affected by stroke. For example, if a stroke, someone could have tingling on their left side. You may develop uncomfortable tingling sensation on the arm. People may be so sensitive to temperature changes, especially central stroke pain or central pain syndrome. And we see that this condition generally develops several weeks after a stroke, and it may improve over time. So it's not, it will
so you
improve.
Get numbness in your face, your legs, your arm, especially on one side.
One side, you could get that. And with a stroke, you always look for that facial droop. You will see that wherever the stroke is. Also, I want to note, if you see that a person have a left side weakness, that means the person is having a right side stroke. So wherever you get a stroke, it affects the opposite side of your body. Changes in behavior and self-care ability. People who have had a stroke can become more withdrawn and less social, or more even impulsive, you know what I'm saying? And I've experienced these things. They may need help with grooming and with daily chores. So you can imagine how difficult that is. And as with any brain injury, the succeed of treatment, these complications vary from person to person. As I always tell people, we are individual.
Healthcare is not an umbrella.
Right,
it doesn't
exactly,
cover everything. So everybody have their own individual care. Now, what causes a stroke? Common causes: arteriosclerosis.
Yes.
Hardening of the arteries by fat, calcium, or which means less space for the blood flow and the oxygen to go in.
And we're talking, and we're going to talk a little bit about diet, and I have a little plan here. We're going to talk about diet, as you were saying.
And a lot of folks might be asking, does smoking increase my risk? Does
Absolutely.
drinking,
Absolutely.
does lack of exercise increase my risk of a stroke?
Yes.
High
yes.
blood pressure,
yes.
diabetes, obesity, all of those are increasing
And
your
we
risk.
we will talk about all of that as soon as we come back from another song. The question is it preventable?
That's right.
So we're going to go right to that as soon as we get some...
Gopal Gangaram, good
yes.
evening to you, the Caribbean Voice team. Good evening to each and every one of you. Our other Vice President, Dr. Rodney, good night to Lenai. Good night to each and every one of you. Juanita Khan, Arjuna Madra is giving us a lot of love. And loving is good, but sharing is more important as it brings forward more attention to your followers on Facebook.
मेरे ख्वाबों में जो आए आके मुझे छेड़ जाए मेरे ख्वाबों में जो आए आके मुझे छेड़ जाए उससे कहो कभी सामने तो आए मेरे ख्वाबों में जो आए आके मुझे छेड़ जाए उससे कहो कभी सामने तो आए मेरे ख्वाबों में जो
Why? Tell me why? Why we thinking suicide?
This is Satish Shudairam, and I say suicide is not the answer. There is always a helping hand for a brighter tomorrow.
Why? Tell me why? Why we thinking suicide? Why? Tell me why? Why we thinking suicide? Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we cuss and fight. Tell me why we drink and drive. Tell me why we thinking suicide. Tell me why we thinking suicide.
You, and you, be that change. Take a stand. Suicide is not the answer. Satish Shudairam says, faith, hope, and love.
If you feel like giving up, today is not the day. Give love a chance, you will shine another day. If you feel like giving up, today is not the day. Give love a chance, you will shine another day. Give thanks and praise to the ones who love you, and the ones who hurt you, let them go them way. Why? Tell me why? Why?
जादू सा जैसे कोई चलने लगा है मैं क्या करूं दिल में चलने लगा है तेरा दीवाना हूं कहता है वो छुप छुप के फिर क्यों रहता है वो कर बैठा भूल वो ले आया फूल वो उससे कहो जाए चांद लेके आए मेरे ख्वाबों में जो आके मुझे छेड़ जाए मेरे ख्वाबों में जो आके मुझे छेड़ जाए उससे कहो कभी सामने तो आए ला 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 ला
Bollywood Dhamaka, a musical journey by Mr. Bollywood himself, Anthony Prasad. Love is in the air, and yes, thank you for joining us on the Caribbean Voice every Monday right here on Island Zone Radio, and we'll continue our topic tonight with stroke.
That's right. Let's go. Do you think it's preventable?
preventable? Well, we have to learn to eat healthy and exercise. A few
That's
things
right.
we have to put in implications and implement in our daily, lifestyle
That's right.
changes.
Are stroke preventable? It says, though there are some risk factors that cannot be modified, higher risk with age, sex, family history, and we know also, we said earlier that male gets stroke more than female, right? And certain ethnic groups, such as African American, Hispanics, and Asian heritage, and having a family history of stroke. The good news is it's up to 80% of all strokes are preventable. So that's a huge factor. 80% of people, it's preventable, okay? It is important to assess and control these risk factors before they cause problems. Number one, too, we have high blood pressure. Stroke are 4 to 6 times more likely to occur with people with high blood pressure. So as we talk about high blood pressure, important thing to do, always monitor your blood pressure. Take your medication as your doctor order. Do not skip the doses. Not because you're feeling well, that means you're going to stop taking medication. No, you don't want to do that.
You might have a relapse, so you take it as prescribed. They are doctors. They know why they tell you 2 times per day, 3 times per day, after meals, before meals, because they have they counteract also differently with other medications.
That's right. And most blood pressure medication, you have to just take it once a day. Also, we're talking, if you're 55 years or older, you're more susceptible to having a stroke. High cholesterol. People with high cholesterol are at double the risk of having a stroke. And sometimes we don't realize that and you and I know, Shanaz, that when we go outside, we eat so bad. We eat the chicken, the fried food, fry everything, what I'm saying, with the milk and all these things. I cut down
tremendously because I feel like if you should give advice, you should have to learn to follow your advice. And I've been eating oatmeal at least twice a week for cholesterol, which is very healthy. And, someone asked me, Shanaz, how come you're not gaining weight? Because, you have to grab your health by the horn. Don't wait for others to take care of you while you could take care of yourself. And don't speak on health if you're not going to do that, So eat healthy and exercise. Also, smoking contribute towards a stroke.
Yes, heavy alcohol, smoking, have double the risk for stroke rather than non-smokers. And also, we have to talk about people then secondhand smoking, which is bad too, and it's no good. And talk about cholesterol. You're talking about what you eat.
Right.
You know what I like to do sometimes when I'm having those kind of oatmeal where you're talking about? I like to add some cinnamon to that.
Cranberry, raisins, cinnamon. Right. Make it a little tasty, make it flavorful. And earlier this afternoon, I was having a cup in my office, actually, and the IT guy walked in. He's like, I'm smelling maple syrup. I'm like, yeah, that's my oatmeal and maple syrup. So make things, you don't have to be, it's a health food. Make it tasty, make it flavorful so you could enjoy it as well. And speaking of health food, we're getting a little, I think it's Christmas time. We're having chocolate in our studio. So, you have to treat yourself well. Yes. Bend the rules a little bit, but you know when to put yourself, well, you know what? You're going to the doctor. You want to make sure everything is A-okay. So
also, especially like a lot of red meat is not good for you, and Shanaz, your mother, when you're cooking your chicken, you always take out those fats from the chicken.
Of course,
right?
Always get it. My butcher, they know how I need my meat. If it doesn't come a certain way, believe me. And some people said you make a big deal about it. No, when it comes to my health, you eat well. They should know how to give me lean meat, take off the skin, cut out all excess fat. I don't need to, put that in my system.
That's right. Also, heart disease. Strokes are 6 times more likely to occur in people with heart disease. Being overweight, excessive weight can lead to heart disease, and high cholesterol. These things increase your chances of having a high incidence of stroke. So, and like I always said, you know what? I know sometimes it's not. I was telling Varshini today, it's hard to lose weight. It's easy to put on these weight, and so I'm always encouraging them to eat what's right.
Eat a little bit more greens, Cut off on all the fatty food, and the red meat you said is very dangerous. And cut down slowly. It's not a drastic change. Changes takes time. You implement one new behavior at a time. And as I said, getting too little exercise. You have to put exercise in your daily routine.
And also, if you have heart problems, also make sure you get the okay from your doctor before you go start running on the street and going to the gym. Make sure you get that clearance. There's different exercise for everyone, just to keep mobile. Some folks just need to keep their body moving, but for others in a weight loss program and stuff, you need to keep
going.
That's right. Also, alcohol use, heavy drinking increase the risk for stroke. And, I was reading to Shanaz, you know what, a little drink now and again is not a bad thing to do. Some red wine or a shot.
They say red wine is good for your heart. So if you're drinking, drink it for a medical purpose.
Right. Yeah. Not to get drunk. So a little alcohol is not too bad. Also, like we said earlier, sex, men are more likely to have stroke than women.
And symptoms, and women don't feel the symptoms sometimes. It's like the silent,
Right, and it's a silent killer, if you ever know. As we said before, even people of African American heritage have an increased risk of stroke. Diabetes, people with diabetes are at a higher risk for stroke than non-diabetic people. So, and that's why when you're diabetic, it's important to eat the right food and to maintain your sugar level at normal. And that where it goes to, I always say, type 2 diabetes. If you have type 2 diabetes, you can really control that with diet and exercise. Make sure you eat food that's low in carbohydrates. Don't eat too much sugar. And exercise. Make sure you exercise at least 5 times a week, like for 30 minutes a day. Also, your family history. Those who have a family history of stroke or a prior stroke are at a higher risk for having a stroke. And even to those people who have... so this is a good indication that we should start from young. If you see your mother or your father had a stroke at their young age and they die, guess what?
That's an eye-opener for you.
Eye-opener for you.
That's right.
You should be able to say, you know what, my mother and my father died at such a young age with stroke or this aneurysm that like my mother had, and she died so young. So sometimes I have to do what's right, most of the time. I'm saying I can cheat now and again, but make sure that you try to keep that sugar at a good range and make sure you follow up with your doctor and so on.
Now, the question is, sometimes folks might say, you know what, I am not overweight. That means my cholesterol is quite low.
No, it could still be. You could
right.
still have
Skinny
high cholesterol.
Folks still have
it's
high
what
cholesterol.
What you eat.
So guys, be careful out there. I know a lot of folks say, and that's my job thing. I'm skinny, so I don't have cholesterol. It doesn't go like that. Keshwar Rudy, good evening to you. Good evening to Anita. How you doing? Juanita Khan, thank you very much. I had a mini 4 months old, so it was difficult for me. Oh, I'm glad you nipped that in the butt, Juanita. Tara Thomas, how you doing? Mr. John Namad, good evening to you. Sheila Mangar, how you doing? Good evening. Good evening.
She's from Suriname, so thank you for tuning in,
so
Sheila Mangar.
So we should say Fawaka to Sheila. Good evening to you. Neera, good evening. Mr. Lalman Prasad is joining us from the beautiful Sunshine State, and there's a big Diwali Mela is happening in October in Florida. You might see me down there. Arjuna Madre, thank you very much. And Sheila, how you doing? Champa Siram, good evening to you. Gita Balde, Mr. Shabir Bash, Mr. DJ Fest.
Yeah, Shelly, Chunilal, tune in. Jeffrey said the problem with us, we wait until something happens bad to us to have an opening to take care of ourselves. And that's right, you have to take care of yourself.
And the beautiful Lena said, I am never sick. The only time I went to the hospital when I was giving birth to my son, 28 years. That's because you're taking good care of yourself, Lena, and that's a good, role model. We should all take care of ourselves, as we believe our health is our wealth. No matter how rich you are, if you don't have your health, the doctor sometimes cannot save you.
That's right. And I see Lena was dancing in Florida this weekend. So
that's right. She supported my good friend, Mr. Buddy Singh. We Got Your Back organization. Chutney Wine in Florida was a success. Thank you guys for coming out there. Gita Baldew and Maria Harris, Liz Paduman. She said, eat a lot of eggplants. That's right.
Since Liz is saying that, what I always like to do, she's talking about egg. Things like pak choy and kale and so on, and like I encourage Gita what to do is that, because these things are so beneficial to us, I tell her, listen, don't fry the egg and give it to me just like that. Put a lot of onions, put a lot of vegetables, put some kale inside, put some pak choy. We go to the back, we pick some pak choy. You get some vegetables, even to some peas, and you think
roasted garlic makes it taste very good.
Yes.
Roasted garlic with their kale.
That's right. And then you know what? You add so much more benefit to your meal that you're eating, not just the bare egg. You know what I'm saying? Mm-hmm. And so we're gonna talk a little bit about. Then we're going to go to some music. We're going to talk about preventative medication. If you have had a TIA, a stroke, your doctor may recommend medication to help reduce your risk of having another stroke. Because not because you had one, that means you cannot get one. You can get another one but guess some of the things that the doctor may put you on is things like aspirin.
A blood thinner,
aspirin,
warfarin.
That's a blood thinner. And I do take one every time, now and again. I always take an
it's so
aspirin.
important to carry around with you one. Ladies, put one in your pocketbook. Guys should always have one in a little tissue in their wallet, because that could save a life. That will give the doctors chance to, if you have an emergency, to work on you better. As they say, every second count while you're enduring episode of a stroke.
Yeah, I see Juanita Khan says good night to all of you, and we are so glad that you're tuning into this program, because Shanaz, when I'm planning these kind of programs, I want to really dig in to see how much information we can share with our viewers. And I'm sure when you're pulling up information that we're going to share on this program, we want to give you the best information. And we go to Anand Budra, myself, and you. We sit down and think of what topic could be useful for our audience and for our viewers that could help them to live a better life and to enjoy the best of life. And we were talking about things like heparin and Coumadin and so on. Yes, these things are very good for you. They help thin in your blood. It's like a more aggressive treatment. When I was in a hospital working, patients would be on heparin, and heparin really thins that blood quickly. But the important thing is that when you're getting things like heparin, you have to be very careful. They have to monitor your blood. Like
with
every
a PT
couple hours,
INR blood test, you always go in for a blood test because you could drop to a certain level and becomes too dangerous.
And
so
you have to be very careful. You don't wipe yourself too hard. You don't get a cut. You don't bruise yourself. So you have to be very, very careful for these kind of things. So we're going to ask our DJ to play a good song for us. And when we come back, we're going to talk how you can really help your family member who have suffered a stroke.
And start helping yourself. Remember, healthcare begins with you. Let's go. Special song going out to all our wonderful viewers on Island Zone Radio. Do enjoy.
Makes me forget that I still need you so much. Red wine. It's up to you.
I'm Rita Khan. Good evening to you, Ryan Jeffrey, Savi, Atar. Good evening, Gita Baldeo.
Ryan says that the vermicelli was really good. I'm so glad that you enjoyed it. Good for you.
Stay close to me. Don't let me be alone. It's tearing apart my blue.
They say red wine is good for your heart, so drink in moderation, and we say no to alcoholism. And remember, don't let friends drink and drive. Save a life. Everyone's life is very valuable. You don't know who they have at home, kids, wife, husbands.
That's right. That's right. Well, it's a good thing that I really don't drink, so I don't have to worry about that. But sometimes worry when I go out and somebody give me a shot and I get drunk.
Well, sometimes you don't worry about yourself not drinking. Other people might be drinking and driving. So even though we know ourselves, we have to think of the roadway as dangerous on the other person's.
It is true. It is true.
Endangering our life. Bibi Ali, good evening to you. Maria Harris, good night. Good night. Ramesh Ramotarg, how you doing? Savi, good night. The beautiful Liz Paduman, she said she just finished a glass of wine. Well, we just had a cup of tea in NYC. Savi, good evening. Thank you, Juanita Khan. And yes, Mr. John Namat, he's drinking Coca-Cola right now. September 10th is our National Suicide Prevention Day. Candlelight Vigil, September 10th. Help organize one of the vigils and do call into our radio program. Ken will be the anchor guy here. And we want to see you. We're actually trying to do a video call so we could see what's happening in your area. Maureen Ramchurn, good evening to you. Geeta Baldev, good evening.
And you're going to be in Richmond Hill. I'm so encouraging guys from Richmond Hill. As you know, we have so much Guyanese living in Richmond Hill. We encourage you guys to touch base with Shanaz.
Come and meet me in front of
have
Big
a
Well
lot of
Bakery
people
and
there.
Halal Restaurant, 107th Street and Liberty Avenue, as we'll be hosting our candlelight vigil right there. I expect to see Mr. Arjuna Madre and all the wonderful folks living in NYC. And Lenite, please take it upon yourself to organize one in Florida for us.
That's right. She's always supportive. So guys, please don't forget. Just get some candles together, get some family members together, and you can guys have a good conversation. It's important. I forget, as we were talking about food, I'm saying a diet containing 5 or more daily serving of fruits, vegetable may reduce the risk of stroke following the Mediterranean diet, which emphasizes olive oil, fruits, nuts, vegetables, and whole grain may be very helpful. And I sometimes don't like to talk about Guyanese a lot but we have to emphasize and we have to see things how it is. We are accustomed in Guyana to eat just roti and curry and rice and so on. But here in the United States, there is so many different things so much fruits and vegetables that we can do.
And healthier selection. There's
That's
a
right.
wide range of food you could choose from. Whole wheat bread. Growing up,
Right,
we didn't know there
right.
was whole wheat bread,
Mhm.
whole wheat flour to make roti. So little by little, you could implement these things in your daily routine. No one wants to eat healthy. Even whole wheat pasta now, for those of you who love pasta,
Yeah.
everything is on a healthy note.
And also, like sometimes I say, you know what, even if you like the white flour, you can always make some dal puri and enjoy it still. It doesn't have a lot of the flour that you will eat with a fat, big sada
You
roti
might
that
eat
you
it
will
know
eat.
you're enjoying something on a healthy note. I
Right.
would rather take care of myself now and eat healthy now. Priya Prasad, good evening to you. Yes, you can post a picture. You could also organize a vigil and call into our Facebook Live by video chat, and you'll see Kenneth, and Kenneth will be seeing you what you're doing in Guyana. World Suicide Prevention Day is September 10th. Please organize a candlelight vigil and call into the Caribbean Voice Media page. Kenneth is our anchor for that night. I'll be hosting it from 107th Street and Liberty Avenue. Please join me there. DJ Fest will be having one as well, and maybe he'll be the anchor on this program as well.
Yes, I'm hoping that he will team up with me and we will end up by his house so we could get to see all the viewers from all over the world.
That's
People
right. We
from
have
Guyana,
something
Trinidad.
big planned for September 10th, and we urge you guys to get involved. Organize a candlelight vigil September 10th, and hey, call us on Facebook so we could see what you're doing. Tag us on all your pictures. That is hashtag the Caribbean Voice, and we are going far away. We're extending into Jamaica, Barbados, Trinidad. We had our
St. Vincent,
spokesperson.
Canada.
That's right. Making a difference around the world, because suicide prevention is everybody's
It's business, yes.
5 minutes of your time could save a life. And you want to get involved in your healthcare, it starts today. Healthcare begins with you.
And yes, and I would like to say special thanks to, I know Ryan Jeffrey does not like to hear thank you so much, but thank you very much, Ryan Jeffrey, for making all of this happen. And I know
Our
that you...
technical team.
Yes,
Thank you to our technical team. And Saif Ivan, good night to you. How you doing? We need to contact you. Ryan Jeffrey, DJ Fest. The date is September 14. What's happening September 14 at Amazur Concert Hall?
That's the Gunga Ghana man.
That's right. Caribbean Fest, guys. Come and see Mr. Dubraj Prasad alongside Hurricane, the beautiful Hurricane from Trinidad, and a wonderful cast. And Rakesh Yankar will be there alongside myself and DJ Fest sharing the stage with all the wonderful artists. Support Island Zone Radio and Elite Sound, manifesting miracles around the world.
That's right. That's right. Let's go. Let's say, Shanaz, there's so many things that we can do for a family. And you know, when we first find out that our husband or a wife or a spouse survive a stroke, and I say survive a stroke, you immediately thought is likely pure happiness, and you're glad that they have survived a stroke. But then uncertainty might settle in. What the journey like for recovering from a stroke? The path to recovery from a stroke, when a person has had a stroke and comes to the emergency, the first thing the doctors want to do, or we want to do, is to save a life. And I can tell you, working on the cardiac floor years ago, somebody have a chest pain or somebody stop breathing, we run to save that person, and we give
everybody drop what they're doing.
You drop everything what you're doing.
You grab
just
the
to save
oxygen
that
tank,
life.
you grab everything, open your crash cart, and you are
know.
there.
Yes, I used to do that. Run with that cart. You know, I was the only male nurse on that floor. So I would grab that cart quick and run to just save that person. And if people only know how much nurses really do to really save their life. And big up to all the nurses and all the workers at the hospital, even to the aides, even to the secretary. They have to get those label printouts so they could send that blood work quick. It's a lot of work, you know.
Sony Dale Saran, good evening to you. How you doing? Gita Balde, Ryan, good night. And the famous John from Queens. The big up to our editor. When it comes to editing our program, you can watch it on Verizon Fios and Spectrum TV. That is channel 34, channel 56 in NYC, and it's going to be a recap a few weeks behind because we're always editing our program for the television, Spectrum TV and Verizon Fios 56 and channel 34.
Once your spouse is out of immediate danger, question begins. The first thing we want to do is to find out why they had a stroke. Then what measure can we take to prevent another one from happening? For example, depending on the type of stroke you had, certain medications can prevent a second stroke. The patient gets a lot of testing within the first 24 or 48 hours they go to the hospital. And as we know, they start them on, as soon as they're stable enough, physical therapy and occupational therapy. And that could help the patient to get in a better state, you know what I'm saying? Sometimes what the doctor will do is to send that person to a rehab center where they have all these physical therapy speech therapists, and they have all these things so they could get these things. And sometimes, you know, as some of Guyanese does not really like to go to
you know, before I used to think that, you know, we adopted this lifestyle here. We're putting our elderly folks in a nursing home or in a rehab facilities. But now I see the importance of how valuable it is than keeping them home. You put them in a specialized office or a facility that could go, you know, help them with their needs and their wants. They have in the nursing home or this, you know, senior center home, they have doctors 24 hours. They have nurses 24 hours to your care. So of course, you know, having an elderly at home who is sick, they're not getting the care, they're not getting the need, you know, meet. So I would urge you guys, if you can't take care of someone, put them. But you remember, healthcare, if you're not checking up on a person, you know how it is in the nursing home or rehab facilities.
That's a whole different story.
Right. If you're not following up with your loved one, they don't get the proper care. But if you're there, showing that you're attentive, they will be taking care of you.
That's right. That's right. And here is some things that you can really do for and please listen to this, what you can really do for your family who has suffered a stroke. Though you might feel helpless while your husband or wife is going through the rehabilitation process, you know, there are things that you can do to help with their recovery. Don't help them too much. One of the hardest things to do sometimes is to watch your spouse do things and you're not there to help them. But you will see your spouse struggling with a fork, cutting up their food, trying to do things. Don't interrupt them. Left them alone. Let them try. Let them struggle a little bit to cut up that food and to sit down properly and try to do things. Don't help them until you see like they're really in a really helpful state that they really want help.
Right.
That you do
Because
that.
you know what? As children, we grow up learning that. It might be difficult to start with, but you will get to it eventually. And helping that person is not making them doing it.
Right. You help them, and you help them to help themselves. And why you do that? By allowing them to do things for themselves. Also,
and
we
also
said,
feel independent, that they could do something for themselves, because going through the rehabilitation process, you feel unwanted, you feel like you can't serve a purpose, and you become a burden for someone. Make them feel happy that you're helping them and you're not a burden to them.
and a lot of people like to do things for themselves, so it's always a good thing to encourage them to do things for themselves. Let them eat them food themselves. You know what I'm saying? I mean, what is safety? You make sure you let them do that. Depression also, we talked about depression earlier. Always have them around you, chit-chatting, doing whatever it is.
Keep their minds occupied.
Don't put them in a room and lock them up and leave them there, because guess what? You don't know what they're going through in their mind, right? You don't want them to feel hopeless and helpless and sad about what happened. The other thing
depression leads to
suicide.
That's right.
And guess what? A lot of older people commit suicide too because of depression
and chronic illness.
That's
you
right.
Know what? Join the Caribbean Voice in observing World Suicide Prevention Day, which is September 10th. You can help by organizing a candlelight vigil in your area, your community, and hey, call us on Facebook Live so you could see what's happening around the world. Juanita Khan, good night to you. Harry George, good night. Thank you guys very much for tuning in. Mr. John Namat, Arjuna Madre, Savi Atar, good night, good night.
That's right. Also, be patient. To say the least, recovering from a stroke can be incredibly frustrating and aggravating at times for the stroke survivor. Oftentimes, they will lash out at the people closest to them because they know that, no matter what's happening, that they will still love them no matter what's going on. Find other ways to communicate. You know what I'm saying? When a person have difficulty speaking because there has been damage to part of the brain, and the control of language is very common with people who have had a stroke. An estimated of 80,000 people have difficulty talking each year with a stroke. It's probably one of the most frustrating deficit because you're unable to get the words out. And like I said earlier, Shanaz, it's always good if they can't talk or whatever it is, you can utilize your pencil and a pen and get some paper and you can let them write what's going on, especially if the person can read and write. A few ways to help your spouse deal with difficulty speaking: give your spouse ample time to talk. Give them time. Don't butt in. Don't cut them. Let them continue their conversation. Let them continue their sentence. Ask if it's okay to guess what they're saying. Sometimes you can do that. Look into speech assistance device, such as the iPhone app. And now there's so much app on these phones that they could help in so much. They can even type sometime on the iPhone and let you to be able to read.
That's right. And if you have any kind of allergic reaction or you're suffering from something, there's all these necklace you could wear, a band that says, you're allergic to some things or your health status.
That's right. People have photo maps and paper or pencil on hand. Like I said before, people may be able to write what they want to say, but aren't able to say. And one of the good thing I want to say, Shanaz, the good news for stroke survivor, 10% of stroke survivor recover almost completely. So we know there is a chance that you can really survive if you do all the right thing. 25% recover from minor impairment and 40% have moderate to severe impairment needs, which needs special care. And like I encourage you guys, we are about to wrap up things here. What I want to encourage you with a stroke, if you know someone who have a stroke or you have a stroke, you have to push yourself. You have to walk, continue exercising, eat healthy, take your medication as your doctor order. Also, we always encourage people to do on our program, don't forget to take care of yourself. We know it's easier said than done when you have a spouse who requires constant care because of his or her stroke. Enhance your endurance and mood. Learn everything you can do about stroke. I always tell people on this program, we always talk about this. Anytime you've been diagnosed with some illness, make sure you read about it. Know how you can help your spouse. Know what you can do. The more knowledge you have is the more you're empowered to do what's right. Set boundaries when to say no and when it's appropriate. Don't dwell on what you cannot change. A lot of times you sit down and you dwell on things. Limit caffeine. Get adequate sleep. Maintain a healthy diet. We talk over and over on this program since we start this program. eat healthy. Find a support system. It's always good. You and I know, Shanaz, that when you have problems, you need to talk to somebody. Find somebody who you can talk to. Find somebody who you can trust, and you could let them know how you're feeling. Sometimes, some people, they're not open, especially our Guyanese people, to chit-chat with their children. They don't have that kind of relationship, and so they may want to talk to somebody who is another older person who are with their age. They may want to do that. Share your feelings with someone who can listen. Go talk to someone who would not want to listen to you, because that's really bad. It'll just make you feel worse than thing. Focus on the thing you are grateful for every day. And be thankful for little things that people do. You know what I'm saying? Invest in your spiritual life. We talk about yoga. We talk about going to church sometimes.
Meditation.
Spend time, yes. We call the word
self-care.
Self-care, so important after all these things. Ladies and gentlemen, I'm so glad we were able to bring this program to you. I hope in my heart that you guys, Shanaz and myself and the whole Caribbean Voice team, hope that you've enjoyed this program, because you and I know there's so many people suffering from stroke, not only in the United States, but across Guyana and around the world.
John Namad, good night to you. Thank you very much, Lina. She said being a nurse is not easy. It's a tough job. It's a lot of sacrifices. You have to deal with so much. But remember, when you're in healthcare, you're there because your heart is there to take care of others. Right. You're not there. A lot of folks said, you know what, they just want to work 9 to 5, but healthcare is 24/7. Gita Baldeo said she'll be supporting us by lighting a dia at her window. So thank you very much, Gita Baldeo. Maureen Ramcharan, Harry George, how you doing? And good night to Rocky. Rocky, please, we're urging each and every one of you to organize a candlelight vigil. We didn't have this media last year to urge you guys, so this is your chance. Take a picture with your group. Hashtag us on Facebook. That is the Caribbean Voice Media. Rocky, thank you very much. And I'm hoping we could get lots and lots of pictures so we could share it on our Facebook wall.
To add to, Shanaz, like some people do not have a lot of family members. They may be just by themselves. You can even just light the candle by yourself. Send us a picture with yourself and the dia or the
I'll
candle.
I'll be having one at work. Ken is urging his workers as well.
Right.
He'll be doing one at his office. I'll do one at my office, and we'll be sharing it with you guys. There are many free counseling programs in your city. People just need to reach out. Thank you, Savi, for sharing that. Sharing is always caring. Maria, good night to you. That's right. We are sharing our good comments. And yes, if you would like to speak to someone, the Caribbean Voice is here to listen. 5 minutes of your time could save a life. If you know someone in need of counseling, reach out to us, the Caribbean Voice, on Facebook. Nina Chudilal, good night to you. She's giving us a rose. And Arjuna Madre said, stay away from all those things. And all those things I enjoy. That's a cake, a burger, shrimp, seafood, Coke. All the good things in life sometimes not good for us.
You're telling me, I always tell people, the things that we like and the things
that taste good.
You know what I'm saying?
Not
it's
good
for
you.
us. I'm telling you. I always, years ago, I always used to get a large coffee, light and sweet. But I tell you, that was no good either. So, you know what I'm saying? We have to eat healthy and we have to do what's right. And it's good that we are having this program too, that we can encourage our younger people to start eating healthy.
And take care of themselves. Speaking of younger folks, hey, Robin Kisoon, how you doing? Take care of yourself as well, Rocky, and all the wonderful folks. You know, when you speak of healthcare, you think of age. You think of, okay, I'm not 50 as yet, but you don't have to be 50 to start taking care of yourself. Your health is your wealth. Start cooking. For all your moms out there, start cooking healthy and delicious meals. Stay away from the red meat and all the curry dishes and all the rice at late, dinner.
Right.
Substitute them for something healthy, maybe a slice of salmon with some salad.
Yeah, and even the sardine is good to eat too.
Omega-3.
That's right. So
eat healthy and we will be able to live longer. Nalini Ramjeet, good evening to you.
Oh, that's one of my cousins from Wales. Thank you for tuning in.
And Priya Prasad, thank you, Priya. Victoria, how you doing? Good night. Sharing is caring. We're hoping you guys are sharing this on at least your Facebook Live.
That's
Not all
right,
the
that's
groups,
right.
but we'll love to see it on all your Facebook wall. Natasha Carrington, good night to you from Antigua.
Well, thank you very much for tuning in, Natasha. And please encourage your family and your friends to watch our program. And you can always please share on your page so they could see and get some of this valuable information that we are sharing with you guys. Okay?
That's right. Every Monday, 8 to 10 p.m., right here on Island Zone Radio is the Caribbean Voice presentation of the Mind-Body Connection. We are here to connect with you. Reach out to us, the Caribbean Voice. I'm Shanaz.
And I'm Ken Rampersad.
Until next time, we hope to see you guys soon. Get involved in charity and give back. Hey, Victoria, thank you guys very much. We start 8 p.m. and we wrap it up around 10 p.m. with you guys in mind. If you would like us to talk about something in particular, reach out to us and we'll get that topic covered.
So let's go to the DJ. He's going to play a nice song for us.
All the wonderful viewers out
Deepa
there.
Dasrat is on. Thank you very much, my dear.
So dedicated to all you viewers. Thank you for sharing. Sharing is always caring.
We're going to send you guys to sleep on a good night. And think about the mind-body connection and the Caribbean Voice.
And be the pillow that you dream of. So darling, I can dream on it too. Each night while I'm sleeping, oh so lonely, I'll share your love and dreams that once were true. I've waited so long for you to write me, but just a memory's all that's left of you. Send me the pillow that you dream of. Don't you know that I still care for you? Send me the pillow that you dream of. So darling, I can dream on it too.
Tara Thomas and the beautiful Una Prasad, Lina Deepa Dasrat, Arjuna Matre, Revin Kisun.
Each night while I'm sleeping, oh so lonely, I'll share your love and dreams that once were true. I've waited so long for you to write me, but just a memory's all that's left of you. Send me the pillow that you dream of. Don't you know that I still care for you?
And yes, we the Caribbean Voice do care for
Be
you.
the pillow that you dream of. So darling, I can dream on it too. Send me the pillow that you dream of. Don't you know that I still care for you?
And we will always care for you. On behalf of the Caribbean Voice, we're saying good night for now. Join us next Monday, 8 to 10 p.m. right here on Island Zone Radio.
That's right, that's right. Have a very pleasant night, everyone.
And a productive week ahead. Until next time, see you. Take care. All the best.
For 27 years, I dreamt of you.